Thank you so much, Mr. Scalise, Representative Scalise. Thank you to also Representative Comer and all of our panelists for coming. It's unfortunate that the entire committee could not join us for this important discussion because, as we've already heard, understanding the origins of COVID-19 pandemic has both public health and national security implications. We all know that Wuhan, China, where the COVID-19 virus originated, is home to the Wuhan Institute of Virology. The Wuhan Institute of Virology is China's only cellular level 4 biosafety super laboratory that researches human infectious diseases. This lab is only a few miles away from the wet market that is said to be the origin of COVID-19. As many of my colleagues have already stated, I went to the floor earlier this month to call for a full and thorough investigation into the origins of COVID-19. There needs to be a serious investigation into the origins of COVID-19, and we must uncover what the Chinese Communist Party knew and when, and what the World Health Organization knew and when. Why do we think that this came from a laboratory or a lab leak as versus to natural evolutionary? One is the initial concern by scientists and the fact that their article was removed by the Chinese Communist Party off of the internet. Two is the proximity of WIV to the wet market. 3, no intermediate host, and we know that we rapidly discovered the intermediate host for both SARS and MERS. 4, the Chinese Communist Party vigorously lobbied WHO to both deny human-to-human transmission and to avoid or delay announcing an international emergency or pandemic. 5, the removal of scientific papers by Chinese scientists from the internet early in 2020, and then, as previously stated, they took their database offline last fall. We also know that the speed and rapidity and the number of variants and then the unique genetic code. So we must hold the Chinese Communist Party accountable for their missteps, of which this is only one. While they were stalling and not notifying the World Health Organization about the extent of the COVID-19 outbreak, the Department of Homeland Security Intelligence Enterprise found that the CCP used this time to stockpile masks, gowns, and gloves. This lost time put U.S. frontline workers at risk and undoubtedly contributed to at least some of the 600,000 U.S. deaths from COVID-19. To prevent something like this from happening in the future, we must seriously consider and examine how much scrutiny we place on laboratories working with highly infectious agents. Furthermore, we need to make sure our media gatekeepers are more cautious and allow science to work before censoring information or suppressing information. While no scientific changes have occurred, the media has recently decided to allow the theory that the SARS-CoV-2 originated in a lab to actually be shared with the American people. This is after a year of downplaying and scrutinizing that theory. And people rightly may ask, why does it matter what the origins of COVID are? We've lived through the pandemic, the vaccines are working, and we're getting back to normal. But as a former director of the Iowa Department of Public Health and as a physician, I know that this pandemic will not be the last. We must get to the bottom of the origins to try to prevent our next public health emergency. As a member of Congress, I believe it is our responsibility to ensure that other nations live up to their responsibilities and that international organizations in which we participate and fund are well regulated and beneficial for the American people. International health regulations state that each state party shall notify WHO within 24 hours of all events which may constitute a public health emergency of international concern. According to the reports from Hong Kong, the CCP identified cases of COVID-19 going all the way back to November 17, 2019, over a month before the WHO was officially notified or publicly notified. If the CCP had complied with these regulations, it's possible we could have worked with our international partners to more quickly contain the virus, limit travel, isolate people before they traveled, and shut down travel more rapidly. More urgency about the virus if it was a lab leak versus of natural evolutionary causes, less complacency of individuals. It's incumbent upon the international community to have safety protocols for the laboratories, the type of research that can be conducted. Is it ethical to bring a virus from the wild into a laboratory? And is it ethical to have gain-of-function research that increases its transmission in humans? Also, publications in prestigious journals, which is what we as scientists and doctors like to do and for which we aspire. But should they publish scientific articles if the lab is not in compliance with safety standards, or if there is not full disclosure and financial disclosure and conflicts of interest? Should we have viruses that are in the wild that we bring into laboratories and then manipulate them for gain-of-function research? As Representative Scalise said, this is the Chernobyl of virus research, and it should underscore the need for increased scrutiny of gain-of-function research anywhere in the world. Because it is the hubris and arrogance of human scientists that failed the basic function of security and safety. If we are going to be serious about advancing scientifically in order to prepare for our next pandemic, then we must let science work. We must allow for debate and dissenting views to be heard, or we may never get to the root cause of this problem and hold the Chinese Communist Party accountable. Thank you.
Thank you, Dr. Miller-Meeks. And now, Dr.